Welcome to Wally's Nursing Videos, where we dive deep into the world of healthcare. Today, we're delving into the intriguing topic of mood disorders. So, grab your notepads and let's explore this essential aspect of mental health. Firstly, let's understand what mood disorders, also known as affective disorders, are all about. These disorders involve pervasive alterations in emotions, often characterized by states of depression, mania, or a combination of both. The impact on an individual's life can be profound, leading to long-term experiences of sadness, agitation, or elation. As we journey through the pages of history, we find that individuals with mood disorders have been present throughout time. Surprisingly, it wasn't until the mid-1950s that treatments for serious depression or mania became available. This highlights the significant challenges people faced in managing these conditions before the advent of effective interventions. It's crucial to note that mood disorders, particularly depression, are strongly associated with an increased risk of suicide. Understanding and addressing these disorders is vital not only for improving mental well-being, but also for preventing serious consequences. Now let's break down the categories of mood disorders. Major depressive disorder, MDD. This condition is characterized by episodes lasting at least 2 weeks, involving persistent low mood, loss of interest or pleasure, and other cognitive and physical symptoms. Bipolar disorder, I or II. Bipolar disorders are marked by episodes of both depression and mania or hypomania. Bipolar I involves full-blown manic episodes, while bipolar II features periods of depression and hypomania. Related disorders. This category includes various conditions such as persistent depressive, dysthymic disorder, disruptive mood dysregulation disorder, cyclothymic disorder, substance-induced depressive or bipolar disorder, seasonal affective disorder, postpartum blues, depression, or psychosis, premenstrual dysphoric disorder, and non-suicidal self-injury. Now, let's delve into the fascinating realm of etiology, exploring the various factors that contribute to the development of mood disorders. Biologic theories propose that biological factors play a significant role in the onset of mood disorders. Genetic theories suggest that certain genetic predispositions may make individuals more susceptible to these conditions. Furthermore, neurochemical theories implicate imbalances in neurotransmitters such as serotonin, norepinephrine, and possibly acetylcholine and dopamine in the manifestation of mood disorders. Additionally, neuroendocrine influences, including hormonal fluctuations, can impact mood regulation. Psychodynamic theories offer another perspective, focusing on internal conflicts and unconscious processes. Concepts such as self-depreciation, where individuals harbor negative beliefs about themselves, and the interplay between the ego, ideal ego, and superego are central to this framework. Some propose that mania may serve as a defense mechanism against underlying depression, while others view depression as a reaction to adverse life experiences, including the presence of rejecting or unloving parents. Cognitive distortions, such as negative thinking patterns, also play a role in shaping mood disorders. Moving on to cultural considerations, it's essential to recognize that the expression and experience of mood disorders can vary across different cultural contexts. The Hamilton Rating Scale for Depression, a widely used tool, has demonstrated reliability across diverse cultures. Symptoms such as depressed mood, guilt, loss of interests, retardation, slowing, suicidal ideation, psychological anxiety, and somatic complaints manifest across cultures. However, it's important to note that in cultures where there is a tendency to avoid verbalizing emotions openly, these symptoms may be expressed or interpreted differently. Now, let's turn our attention to major depressive disorder, MDD, a condition characterized by persistent and severe feelings of sadness, hopelessness, and loss of interest or pleasure in activities. Here are some key points to consider. An untreated episode of depression can endure for weeks, months, or even years, significantly impacting an individual's quality of life. However, in many cases, symptoms become most clear within about 6 months. It's important to note that MDD is often a recurring condition, with 50% to 60% of individuals experiencing a recurrence at some point. Furthermore, approximately 20% of individuals with MDD will develop a chronic form of depression, requiring long-term management and support. In severe cases, individuals may experience psychotic features such as hallucinations or delusions, adding complexity to their treatment and care. Now, let's explore the realm of psychopharmacology, focusing on the pharmacological interventions commonly used in the management of MDD, selective serotonin reuptake inhibitors, SSRIs. These medications work by increasing the levels of serotonin, a neurotransmitter associated with mood regulation, in the brain. SSRIs are often considered first-line treatment due to their efficacy and relatively mild side effect profile. Tricyclic antidepressants, TCAs. TCAs are an older class of antidepressants that work by blocking the reuptake of serotonin and norepinephrine. While effective, they are associated with more side effects compared to SSRIs and are typically reserved for cases where other treatments have failed. Atypical antidepressants. This category includes medications that don't fit neatly into other classes of antidepressants. Examples include bupropion, mirtazapine, and trazodone, each with its unique mechanism of action and side effect profile. Monoamine oxidase inhibitors, MAOIs. MAOIs inhibit the activity of monoamine oxidase, an enzyme that breaks down neurotransmitters like serotonin, norepinephrine, and dopamine. While effective, MAOIs require strict dietary restrictions and can interact dangerously with certain foods and medications, potentially leading to hypertensive crisis. It's important to be aware of potential complications associated with antidepressant use, such as hypertensive crisis, which can occur when MAOIs are combined with certain foods or medications. Additionally, serotonin syndrome, a potentially life-threatening condition characterized by excessive serotonin levels in the brain, can occur when SSRIs are used in combination with other serotonergic medications. Let's dive deeper into the world of antidepressants, exploring their use, mechanisms of action, and associated side effects. Antidepressants are widely utilized in the management of various psychiatric conditions, including major depressive illness, anxiety disorders, the depressed phase of bipolar disorder, and psychotic depression. They can be classified into four main groups: tricyclic and cyclic compounds, selective serotonin reuptake inhibitors, SSRIs, monoamine oxidase inhibitors, MAOIs, other antidepressants. While the precise mechanism of action of antidepressants is not fully understood, their major interaction is with monoamine neurotransmitter systems, particularly norepinephrine and serotonin in the brain. Now let's explore the side effects associated with each group of antidepressants. SSRIs. Common side effects include anxiety, agitation, akathisia, restlessness, nausea, insomnia, and sexual dysfunction. Some individuals may experience weight gain as a side effect of SSRIs. Tricyclic antidepressants. Side effects may include anticholinergic effects, such as dry mouth, blurred vision, constipation, orthostatic hypotension, a drop in blood pressure upon standing, sedation, and weight gain. Sexual dysfunction can also occur with tricyclic antidepressants. MAOIs. Side effects may include daytime sedation, insomnia, weight gain, dry mouth, orthostatic hypotension, and sexual dysfunction. MAOIs can cause a hypertensive crisis when combined with foods containing tyramine, a compound found in aged or fermented foods. Other antidepressants. Side effects may vary depending on the specific medication. Nefazodone and trazodone may cause sedation and headaches. Bupropion and venlafaxine may lead to loss of appetite, nausea, agitation, and insomnia. Trazodone has the potential to cause priapism, a prolonged and painful erection. Let's explore further into the realm of antidepressants, including drug interactions, client teaching, and additional treatment modalities. Antidepressants can interact with other medications or substances, potentially leading to complications such as serotonin syndrome, a serious and potentially life-threatening condition. When monoamine oxidase inhibitors, MAOIs, are combined with selective serotonin reuptake inhibitors, SSRIs, there's an increased risk of serotonin syndrome. Symptoms may include agitation, sweating, fever, tachycardia, hypotension, rigidity, and hyperreflexia. In extreme cases, serotonin syndrome can lead to coma or death. When educating clients about antidepressant therapy, it's crucial to provide guidance on the timing of dosage and actions for missed doses. SSRIs are typically taken first thing in the morning to minimize disruption of sleep patterns. Cyclic compounds are often administered at night to capitalize on their sedative effects and aid in sleep. In the event of a missed dose, clients should take their SSRI up to 8 hours after the missed dose. For cyclic compounds, if a dose is missed by more than 3 hours, it's often best to omit the dose for that day. Additionally, clients taking MAOIs should be informed about dietary restrictions to avoid foods containing tyramine, which can precipitate a hypertensive crisis. This information is critical for ensuring the safety and efficacy of antidepressant therapy. Beyond pharmacological interventions, there are other medical treatments and psychotherapeutic approaches available for managing mood disorders. Electroconvulsive therapy, ECT, is a procedure in which electrical currents are passed through the brain, often used for severe or treatment-resistant depression. Psychotherapy, when combined with medications, can be highly effective. Approaches such as interpersonal therapy, which focuses on resolving relationship difficulties, behavior therapy, which reinforces positive interactions, and cognitive therapy, which targets cognitive distortions, are commonly employed. Somatic therapies, including transcranial magnetic stimulation, TMS, magnetic seizure therapy, deep brain stimulation, and vagal nerve stimulation, offer alternative treatment options for individuals who may not respond to traditional therapies. Let's explore the application of the nursing process in the context of major depressive disorder, MDD, from assessment to evaluation. Assessment: gather a comprehensive history, including the onset and duration of depressive symptoms, past psychiatric history, family history of mood disorders, and any precipitating factors. Assess the client's general appearance and motor behavior, noting signs of psychomotor retardation or agitation. Evaluate mood and affect, paying attention to symptoms such as anhedonia, loss of interest or pleasure. Explore thought processes and content, including rumination and suicidal thoughts. Assess sensorium and intellectual processes, looking for signs of impaired memory or concentration. Evaluate judgment and insight, noting any impairments in decision-making. Assess self-concept and self-esteem, including feelings of worthlessness or guilt. Explore the client's roles and relationships, recognizing that more severe depression often leads to greater difficulty in fulfilling these roles. Consider physiological and self-care considerations, such as changes in appetite, sleep disturbances, and hygiene. Data analysis and priorities. Analyze the data gathered during the assessment to identify patterns and prioritize nursing interventions. Prioritize outcomes based on the client's needs and preferences. Outcome identification. Collaborate with the client to establish realistic and achievable goals. Outcomes may include freedom from self-injury, independence in activities of daily living, a balanced rest-sleep activity pattern, realistic self-perception, socialization, return to occupational or school activities, medication compliance, and the ability to verbalize symptoms of recurrence. Actions. Implement interventions to address the client's needs and achieve the identified outcomes. Provide for safety by implementing suicide precautions and maintaining a safe environment. Foster a therapeutic relationship based on trust, empathy, and respect. Encourage activities of daily living and physical care to promote self-esteem and autonomy. Utilize therapeutic communication techniques to facilitate expression of feelings and thoughts. Manage medications effectively, including administration, monitoring for side effects, and educating the client and family about medication, compliance, and potential adverse reactions. Evaluation. Assess the client's response to nursing interventions and the achievement of desired outcomes. Monitor for extreme mood swings, indicating possible episodes of mania and depression. Evaluate the client's overall functioning and quality of life. Let's continue our exploration of psychopharmacology in the treatment of mood disorders, focusing on additional medications and therapeutic approaches. Lithium. Lithium is a mood stabilizer commonly used in the treatment of bipolar disorder. It helps to reduce the intensity and frequency of manic episodes, as well as prevent the recurrence of depressive episodes. Lithium works by modulating neurotransmitter activity in the brain, particularly serotonin and norepinephrine. It's important to monitor blood levels of lithium closely, as toxicity can occur at higher doses, leading to adverse effects such as tremors, nausea, and confusion. Anticonvulsant drugs. Some anticonvulsant medications, such as valproic acid, carbamazepine, and lamotrigine, have mood-stabilizing properties and are used in the treatment of bipolar disorder. These medications help to regulate mood fluctuations and reduce the risk of manic and depressive episodes. Like lithium, monitoring blood levels and potential side effects is essential when using anticonvulsants for mood stabilization. Psychotherapy. In addition to medication management, psychotherapy plays a crucial role in the treatment of mood disorders. Various forms of psychotherapy, such as cognitive behavioral therapy, CBT, interpersonal therapy, IPT, and dialectical behavior therapy, DBT, can help individuals with mood disorders learn coping skills, improve interpersonal relationships, and challenge negative thought patterns. Psychotherapy is particularly useful in the management of mild to moderate depressive symptoms and can be combined with medication therapy for optimal outcomes. It's important to note that while psychotherapy can be beneficial in managing mild to moderate depressive symptoms, it may not be as effective during manic stages of bipolar disorder. During manic episodes, pharmacological interventions are typically prioritized to stabilize mood and prevent potential harm associated with impulsive or risky behavior. Let's delve deeper into the realm of mood-stabilizing drugs, their mechanisms of action, side effects, client teaching, and the nursing process application for individuals with bipolar disorder. Mood-stabilizing drugs are crucial in the treatment of bipolar illness, aiming to manage mood swings and prevent episodes of mania or depression. Some commonly used mood stabilizers include lithium and certain anticonvulsants such as carbamazepine, valproic acid, gabapentin, topiramate, oxcarbazepine, and lamotrigine. Mechanism of action varies among these medications. Lithium normalizes the reuptake of certain neurotransmitters, helping to stabilize mood. Valproic acid and topiramate increase the levels of gamma-aminobutyric acid, GABA, an inhibitory neurotransmitter that regulates excitability in the brain. Valproic acid and carbamazepine inhibit the kindling process, which is thought to contribute to the development of mood episodes in bipolar disorder. However, these medications can be associated with various side effects. Lithium may cause gastrointestinal symptoms like nausea, diarrhea, and anorexia, as well as fine hand tremors, polyuria, polydipsia, fatigue, and weight gain. Toxicity can result in severe symptoms such as diarrhea, vomiting, drowsiness, muscle weakness, and lack of coordination. Carbamazepine and valproic acid may lead to drowsiness, sedation, dry mouth, blurred vision, rash, specifically with carbamazepine, and orthostatic hypotension, specifically with valproic acid. Valproic acid may also cause weight gain, alopecia, and hand tremors, while topiramate can induce dizziness, sedation, and weight loss. Client teaching is essential to ensure safe and effective medication management. Regular monitoring of blood levels is necessary, typically taken 12 hours after the last dose. Taking medication with meals can help minimize gastrointestinal side effects. Clients should be educated about safety measures, including precautions to prevent toxicity and interactions with other medications. In the nursing process application for individuals with bipolar disorder, assessment is critical. History taking should include evaluating past episodes of mania or depression, as well as the presence of any comorbid conditions. Observing general appearance, mood, thought processes, and self-concept can provide valuable insights into the individual's current state. Priorities may include preventing self-injury or harm, achieving a balance between rest, sleep, and activity, and promoting socially appropriate behavior. Let's continue our exploration into the sensitive topic of suicide, including assessment, outcome identification, actions, family response, nurses' response, and legal and ethical considerations. Suicide is the intentional act of killing oneself, and it remains a significant public health concern worldwide. Men account for approximately 72% of suicides, but it's essential to recognize that suicidal ideation, or thinking about killing oneself, can affect individuals of any gender. Recognizing warning signs and assessing for risk factors are crucial steps in suicide prevention. Previous suicide attempts, especially within the first 2 years, pose a significant risk, with the highest risk period occurring within the first 3 months. Warnings of suicidal intent, risky behaviors, and lethality assessments are essential components of the assessment process. Outcome identification aims to ensure the safety and well-being of the individual. Goals may include being safe from harming oneself and others, engaging in a therapeutic relationship, reporting suicidal ideation to staff, identifying positive attributes, and developing realistic plans to address underlying issues. Nurses play a vital role in suicide prevention and response, using an authoritative role, providing a safe environment, and creating a support system list are critical actions. When working with families, it's essential to understand that suicide can be perceived as the ultimate rejection, leading to feelings of guilt, shame, and anger. Families may experience disintegration, and nurses must respond with empathy and support. In their interactions with clients, nurses should maintain a non-judgmental approach, demonstrating unconditional positive regard and avoiding blame. Believing in the potential for positive change and making a difference in someone's life is crucial, even in the face of the devastating impact of suicide. From a legal and ethical standpoint, assisted suicide remains a contentious issue, subject to national debate and varying legislation. Nurses often care for terminally or chronically ill individuals facing difficult end-of-life decisions, emphasizing the importance of providing supportive care and assisting clients and families in their decision-making process. Let's continue our exploration, focusing on age-related considerations, community-based care, mental health promotion, and self-awareness issues related to mood disorders. Age-related considerations highlight the unique aspects of mood disorders across different life stages. Disruptive mood dysregulation disorder, DMDD, is typically diagnosed in children aged 6 to 18 years. Suicide ranks as a leading cause of death among children, adolescents, and young adults, underscoring the importance of early intervention and prevention efforts. Depression is prevalent among older adults, often exacerbated by medical illness, with psychotic features more common in this population. Older adults may have increased intolerance to medication side effects, leading to the preference for treatments like electroconvulsive therapy, ECT, for its rapid response. The suicide rate among older adults is double that of younger adults, emphasizing the need for targeted interventions and support. Community-based care plays a crucial role in identifying and addressing mood disorders. Nurses are often the first healthcare professionals to recognize behaviors consistent with mood disorders, highlighting the importance of accurate documentation and reporting to facilitate timely intervention. Successful treatment of depression in the community involves collaboration among psychiatrists, psychiatric advanced practice nurses, and primary care physicians to ensure comprehensive care. Mental health promotion efforts aim to prevent and mitigate the impact of mood disorders. Education addresses stressors contributing to depressive illness, empowering individuals to recognize and manage their mental health. Efforts to improve primary care treatment of depression enhance accessibility and effectiveness of interventions. Prevention and early detection initiatives target adolescents, focusing on screening for risk factors such as family strife, parental alcoholism or mental illness, and access to weapons in the home. Self-awareness is essential for healthcare professionals working with individuals with mood disorders. Acknowledging and processing one's feelings about suicide is crucial for maintaining professionalism and providing effective care. Working with depressed or manic clients can evoke frustration or exhaustion, emphasizing the importance of self-care strategies such as journaling and seeking support from colleagues.